Welcome to the Exam Room Live, a brand new series. And as you know, everyone is washing their hands, they're practicing social distancing, they're doing their best to avoid getting the coronavirus. And health authorities, though, here's the sad reality of the situation. Health authorities believe that despite all of our best efforts, despite the stay-at-home orders and the 6 feet apart and all the hand sanitizer that we're using, eventually most of us are going to catch this thing. But the goal is to flatten the curve. Now, that means to just kind of spread out the time between when everybody catches this disease. So say that everybody catches it in April. Well, we don't want that. The better option, unfortunately, is for people to catch it in May and June, July, August. And that way, if you need it, if you catch this and you need it and you need to go to the hospital, there will be a bed for you that is available. But now you may be saying, well, none of that sounds appealing. I don't care when I catch it. What can I do to put myself in the best position possible to not necessarily need as much medical care? And so joining me to help talk about that today is Dr. Neil Barnard. Welcome to the show, sir.
Thank you, Chuck. Very, very important topic. I can't tell you how important this particular program is. What has really been neglected is this concept of underlying conditions. When you look at who lives and who dies, to a great degree, it comes down to underlying health conditions. You have heard this. In fact, just earlier this week, the Centers for Disease Control and Prevention said that it is true that if you have heart disease, lung disease, hypertension, diabetes, your risk is much higher of needing to go to the hospital, of needing to be in the ICU, or even of dying. Let me give you some figures. If you look at people who people who catch the virus, but they do not have one of these underlying health conditions, their likelihood of needing to go to the intensive care unit about 2%, specifically 2.2 to 2.4%, depending on how you look at the data. You take a person with an underlying condition, their risk is about 6 times higher, between 13 and 15%. So this makes you much more likely to go to the ICU. Then at the extreme end, who dies? About 94% of the people who died, according to CDC data, up until March 28th, 94% of those people who died of this virus had an underlying condition. Again, these are heart problems and the things that lead to it, like high blood pressure, diabetes, or lung problems like asthma. So that then that raises the question, can I address these underlying health issues, and do I have time? I mean, the virus is here now. But let me share with you some really important data, and if it's all right, I'd like to share my screen and have you look at this graph. If you are only hearing the soundtrack and you're not looking at this, what we're looking at is a curve. This curve came from the University of Washington, the Institute for Health Metrics and Evaluation. They're looking at predictions for when this virus will peak. This first graph, I'm going to show you 3 graphs. This one is the United States overall. The peak time of medical usage, medical resource, is coming up in 2 weeks, April 15th. However, look at the back side of that curve, the right-hand side of that curve. What you notice is it's tailing off only very slowly, and it tails off all the way to about July. So what that means is people in the United States are not going to stop being sick. They're not going to stop contracting this virus as of April 15th. That's sort of the first half of the disaster. The second half of the disaster tails off. Now, in different states, it's different. So let's have a look at California. Here's California. You notice it's considerably later. It's about 11 days later, but it still tails out in July. Now look at Florida, later still. It does not peak for 31 days from today, and it still tails off into July. So what does that mean? Some people are going to still be getting sick in May, in June, in July. So let me come back into the room now. Let's say you happen to have one of these health conditions. You do have some time to get yourself together. Now, it would have been ideal if we had been in perfect health last year, but it's not as if we don't have time to take some steps now.
Well, let's talk about some of those steps that we can take, because really the truth is that, I believe you said 94% of everyone who died had an underlying condition. Well, what steps can we take to remove these underlying conditions? We're talking about tackling some of these vulnerabilities. I know that there are three things in particular that we're going to be keying in on here on the Exam Room Live in the future. Smoking is one of them, whether you're going to try patches or gums or just going cold tofu. That's one of the big ones, the vulnerability there that we want to eliminate. How do you get rid of that habit? We're going to be actually talking about that on the show tomorrow at noon Eastern. So set your calendars there. Dr. Vanita Raman will be joining us to discuss that. The other one, Dr. Barnard, as I understand it, that people want to look at is medications. Have you been keeping up with it? If you have high blood pressure medication, have you been taking it? What's in your medicine cabinet? That's very important. We're going to be talking about that on the show next week. But today, let's tackle what I think that a lot of people feel is the biggest one, and perhaps the one that they have the most control over, and that is their diet. So in terms of tackling the diet and eliminating that vulnerability, what can you tell us?
Okay, great. Let me preface this by saying that I am not going to suggest that diet changes will stop you from getting the virus. I wish that they would. And some people are trying to speculate about that possibility. That's not what we're talking about now. What we're talking about is, are you going to, if you catch the virus, what can you do to reduce the vulnerability of needing to be in the ICU or dying of this disease, as opposed to having a more benign course? And what we're specifically thinking about is how to tackle the underlying conditions. And again, in the world of caution, we do not know for sure that if you have diabetes and your diabetes gets better to a degree, will that protect you? We think so, we're not sure. This is uncharted territory, but here's the deal. If you've got the underlying conditions, let's change our diet to get them in as good a shape as possible. Let's start with hypertension. If your blood pressure is up, and Chuck, you already mentioned, get your medications together. So if your blood pressure pills have kind of been neglected and you've gone off them, we're going to come back to that in tomorrow's program about how to get back on track. But your diet can help you as well. This is the time for a completely plant-based diet. Now, if that sounds unusual for blood pressure, you might have heard of the dietary approaches to stop hypertension, the DASH study. This study was done years ago, and it was inspired by the observation that people who avoided meat had lower blood pressure. So they decided in the DASH study, they decided people aren't going to really want to go vegetarian. So they modified it a little bit. They reduced meat, and they greatly increased vegetables and fruits. And they found that, yes, indeed, blood pressure fell, and it fell substantially. We think that the reason it fell is because vegetables and fruits are low in sodium, which would raise blood pressure. They're low in that. But they're also very rich in potassium, which lowers blood pressure. That's good. But it was beyond that. Meat has a lot of bad fat, saturated fat, that thickens up the blood, if I can put it that way. It makes the blood more viscous. If your blood is thicker, more like grease, less like water, it takes more oomph from the heart to push it, so your blood pressure goes up. So you're reducing meat, that reduces your blood viscosity, that reduces your blood pressure. These are the reasons why we believe this is happening. The most important thing, though, in the DASH study was how fast it worked. So you remember that graph that I showed you? This disease is going to be tailing out not until July. The DASH study was exactly 8 weeks long, and they showed the substantial improvement in blood pressure in just that period of time. So if you're listening to this now, thinking all I can do is wash my hands and socially distance, now is the time to get your underlying conditions in gear. We talked about blood pressure, let's talk about diabetes, and we'll go into these in more detail in the future, I'm sure. With regard to diabetes, the same kind of diet changes apply. Get the animal products off your plate, but now it's for a different reason. Insulin normally comes from the pancreas to the cells of the body, where it acts like a key to open the cell to let glucose get into the cell. But if fat from the foods that you eat, chicken fat, beef fat, or for that matter, fryer grease, whatever, if that gets into your cells, it stops insulin from being able to work. To kind of give a simplistic analogy, if your cells are filled with fat, insulin can no longer get the sugar inside. So as you probably know, if you've watched the exam room before, our research has shown over and over again that when people follow a healthy plant-based diet, the blood sugars fall. And we believe that this is because they're getting the fat out of their cells. So get the fatty foods out of your diet. That means the animal products, get rid of them, keep oils really low, and that's going to be a healthful diet for diabetes. Do the other things that you already know about, like avoiding sugar and overly processed foods. Good idea. But if that's all you're doing, it's not enough. You need to get away from the animal products, keep the oils really low. Last thing, we talked about the lungs. For somebody with asthma, they're already concerned about their lung function. Suddenly you've got a respiratory virus that comes in, you're at risk. We don't have all the information that we yet need about asthma, but we do know that some studies have suggested that people who avoid dairy products have better lung function. Many people have done this sort of in their own lives. They've had seasonal allergies. They find they do better when they avoid dairy. They've got asthma, they avoid dairy, they do better. In my view, we haven't had enough research on this, really. I'd like to see better quality research, but the studies that have been done do support the hypothesis that avoiding dairy products improves lung function. And many anecdotal cases show that asthma improves and sometimes goes away. So there's no danger to avoiding dairy. You'll get plenty of calcium from your green leafy vegetables and other healthy foods. Dump the dairy to protect your lungs. So yes, you want to quit smoking. Yes, you want to get your medications together. We're going to talk about that tomorrow. But get your diet in order. Throw away the animal products. Keep the oils really low. There's a lot more resources that we have to help you follow that kind of diet. So if we do those, once again, you may still be vulnerable to this virus. But if you're able to tackle those underlying conditions so they're not making you extra vulnerable, our hope is that you may do better in the event that you contract the virus. And again, we don't know that that's the case, but we do know that these underlying conditions are what tend to lead people to the ICU or worse. So tackle them now. There is a certain amount of time for many people. Let's put it to work.
Dr. Barnard, thank you so much. That's really fascinating. And it never ceases to amaze me how quickly dietary changes can pay off in terms of a person's health. It never ceases to amaze me. So often on the show, I've had the opportunity to speak with people who say, hey, I went vegan, I went plant-based, and after just 7 days, all of my markers were doing so much better, and they just felt better as well. And so I think that health, especially right now, is it's never been a better time to begin to fuel your body with good, healthy foods. Now,
well, let me respond to that. You're absolutely right. And every person is a little bit different, but it's not at all uncommon to see a person who's had type 2 diabetes for a while. And when they follow the diet advice that I just gave, very often within the first week or two, they do start to see their numbers getting better. But for everybody, it's a little bit different. But keep in mind 2 things. Number one, we do have some time now, not a lot, but we got a little. The other thing is most people will survive this. The vast majority of people are going to survive this. If you still got diabetes, why not start improving now? The diabetes you're going to have in November and December and January is something that you want to tackle now, both to survive the virus, hopefully, but also just to survive later on. So now's the time to put it to work.
I couldn't have put it better myself. Thank you, Dr. Barnard. You know, if you've spent any time on social media, whether it be Facebook, like you're watching now, or Twitter or Instagram, you know that the internet is just covered with all kinds of myths and cures about health. And will this prevent me from getting the coronavirus? Will it help if I do get it? There's just so much out there. So we're going to introduce a new segment now. We call it Health Boost or Health Bust. And today we are going to be keying in on garlic. There's so much out there about garlic. And to talk about that health boost or health bust, we're going to welcome in from the Barnard Medical Center registered dietitian, Susan Levin. So Susan, garlic, what is the deal? Health boost or health bust?
Well, I do think it pays to be skeptical when you're reading nutrition, medical advice online. Always question that. I certainly do. And I don't believe, as much as I've read about specific foods, dietary patterns, I don't believe in a superfood or one particular food that's going to solve all your problems. No way. But when it comes to garlic being an immune boosting food, there is actually some good evidence that it very well may be. So I want to point to one specific study because it's a randomized controlled trial, which is the gold standard in research, of course, where they did look at garlic and its effect on a virus, not coronavirus, mind you. This is new, the COVID-19, this is new, but just colds in general. And what they did was they assigned half of the group to a garlic supplement, the other half of a group to a dummy pill or placebo pill to see what happened. And this was 146 people. So this is not a small study in terms of a randomized controlled trial. And what they did this for 12 weeks, so about a 3-month study. And what they found was among the people that took the placebo pill, there were 65 occurrences of what's called the common cold. But among the people who took the garlic supplement, there were only 24 instances of getting a common cold. And then beyond that, what they found, what the people that were taking the placebo, so the dummy pill, had 366 sick days. And among the group that took the garlic supplement, there were only 111 documented sick days. So, about a third of the number of sick days. So that tells me that in a controlled setting, there is something to garlic. And I will have to say that, garlic has other possible benefits. I mean, we've all kind of known that it has a component in it called allicin, which is an antioxidant. So, it certainly doesn't hurt to add garlic to your diet at this point with that kind of a little bit of evidence. Again, that was a common cold study, not a coronavirus study, but it does tell us something about immunity.
That's really good. And garlic is, I mean, you can put that in so many different recipes out there. I bought extra garlic hummus the other day. I went to kiss my wife. She told me to practice social distancing.
Absolutely.
What kind of recipes would you suggest? Do you have any available?
Oh, do I? Yeah. So I think anything, we usually associate garlic with Italian cooking. So there's a great recipe on PCRM's website, spaghetti al pesto, and it's got, it actually asks you to put 4 cloves of garlic in that particular recipe. However, I will say any of our recipes at pcrm.org/pantry, not any, maybe I wouldn't put it in waffles, but if you're looking at a recipe that doesn't have any garlic in it, like a chili recipe, why not? Why not throw some, crunch up some garlic cloves in there, knowing that maybe it'll give you a little bit of a health boost, but certainly it'll give you a taste boost to the recipe. Couldn't hurt.
Garlic waffles. I'm not sure that would fly on anybody's table, to be honest with you. I mean, you have a young son. I mean, would he ever go for the garlic waffle?
It's funny. My husband thinks if 2 things taste good separately, then scientifically they should taste good together. Like, I don't buy that, but he would say, yeah, garlic waffles.
More power to him. Susan Levin, thank you so much. By the way, Susan is available for consultation at the Barnard Medical Center. They're doing telemedicine visits right now. Don't have to come into the office given the current circumstances. All you need to do to schedule an appointment is head over to barnardmedical.org. You can set an appointment to get a consultation with Susan or any one of the doctors at the Barnard Medical Center. Very important to stay healthy right now and take a close look at your diet, especially in these times. So barnardmedical.org is the place to be. Susan, thank you so much for joining us today.
Thank you.
And another great resource that I might suggest, as long as we're on the topic, and maybe you want to look for some garlic recipes, pcrm.org/recipes, or if you have your mobile phone, you can pull up the 21-day Kickstart app. This is a 3-week guide to get you going, take control of your health. It gives you your grocery list. There's a bank of recipes on there. It gives you the ins and outs, everything you need to know to get started with that plant-based diet. It's a phenomenal resource. And of course, you can also head over to pcrm.org/pantry. And so this is the first episode of the Exam Room Live, but the Exam Room podcast has been going now for close to 2 years and is now ranked #1 among all nutrition podcasts here in the States. And we would love to be able to share that with you. So if you head over to Apple Podcast or Spotify or Stitcher and subscribe right now, you are going to get so much information, not just about garlic, but a deeper dive on lowering your blood pressure, reversing diabetes, lowering your risk of cancer, what to do if you have cancer, how does a healthy diet then lower your risk of getting cancer? Again, there's so many great resources available on that show. We would love for you to subscribe. New episodes each and every week, and it's a joy. Plenty of episodes already with Susan and Dr. Barnard. So lots of great information there. And last thing before we wrap up today, I would encourage you, please, to also set your calendar, set a reminder. We're going to be back doing the show again tomorrow at noon Eastern. We would love to see you right back here. But until then, for Dr. Neil Barnard and Susan Levin, I am the weight loss champion, Chuck Carroll. Thank you so very much, and stay safe.